Suctioning. Connect one end of the connecting tubing to the suction machine. Turn the suction device on and adjust the vacuum regulator to less than 150 millimeters mercury. Normally, a pressure between 80 and 120 millimeters mercury is used. If more viscous secretions are present, additional suction may be required. Check the negative pressure of the suction apparatus by occluding the end of the suction tubing before attaching it to the suction catheter. If indicated, increase the supplemental oxygen therapy to 100% or as prescribed. Encourage the patient to take a few deep breaths. Prepare the disposable suction catheter. Using aseptic technique, open the sterile catheter package on a clean surface, using the inside of the wrapping as a sterile field. Open the package just enough to expose the connecting end and connect the catheter to the suction tubing. Place the sterile drape on the bedside table. Do not allow the suction catheter to touch non-sterile surfaces. Unwrap or open the sterile basin and place it on the bedside table. Be careful not to touch the inside of the basin. Fill the basin with sterile 0.9% sodium chloride solution or sterile water. If the patient has a fenestrated tracheostomy tube with a fenestrated inner cannula in place, remove the inner cannula and replace it with a non-fenestrated inner cannula. Remove gloves, perform hand hygiene, and don sterile gloves. Connect the suction catheter to the connecting tubing. With the dominant hand, pick up the suction catheter, taking care to avoid touching any non-sterile surfaces. Wrap the suction catheter around the sterile dominant hand to help prevent inadvertent contamination of the catheter. With the non-dominant hand, pick up the connecting tubing and connect it to the suction catheter. Ensure that the dominant hand does not come in contact with the connecting tubing. Check the equipment for proper functioning by suctioning a small amount of sterile solution from the container. With the dominant hand, gently but quickly insert the catheter into the tracheostomy tube with the control vent of the suction catheter open. In a patient at high risk for suction-related complications, insert the catheter into the tracheostomy tube until it emerges out of the end of the airway. In a patient not at risk for suction-related complications, insert the catheter into the tracheostomy tube until resistance is met, and then pull back 1 to 2 centimeters. Using the non-dominant thumb, depress the control vent of the suction catheter to apply continuous suction while completely withdrawing the catheter. Perform one additional pass of the suction catheter if secretions remain in the airway and the patient is tolerating the procedure. Allow a minimum of 20 to 30 seconds between passes for the patient to recover before the next pass. Consider administering 100% oxygen to the patient between each pass of the suction catheter. At the completion of the suctioning procedure, consider administering 100% oxygen for 30 seconds. Return supplemental oxygen to the baseline level. Assess the volume, consistency, and color of the airway secretions. Notify the practitioner of changes in the airway secretions. Wrap the catheter around the dominant hand after the upper airway suctioning is complete. Pull the sterile glove off the dominant hand inside out. The catheter remains in the glove. Pull the other glove off in the same fashion. Perform hand hygiene and don fresh gloves. If the patient has a fenestrated tracheostomy tube, remove the non-fenestrated inner cannula and replace it with a fenestrated inner cannula. Tracheostomy care with a non-disposable inner cannula. Open the sterile tracheostomy care kit. Open the sterile drape and place it on the bedside using aseptic technique. Dump the contents of the tracheostomy care kit onto the sterile drape, maintaining the sterility of the contents. Place the empty tracheostomy care kit container next to the sterile drape. Remove the cap on the 0.9% sodium chloride solution bottle and pour 0.9% sodium chloride solution into 2 of the divided chambers of the tracheostomy care kit container. Remove the soiled dressing from around the stoma and discard it in an appropriate receptacle. Assess the skin surrounding the tracheostomy for evidence of irritation or infection. While touching only the outer aspect of the tube, unlock and remove the inner cannula of the tracheostomy tube. Drop the inner cannula into the 0.9% sodium chloride solution to loosen secretions. Position the oxygen source over the outer cannula. Remove gloves, perform hand hygiene, and don sterile gloves. Clean the inner cannula. Pick up the inner cannula and use the small brush to remove secretions from inside and outside the cannula. Hold the inner cannula over the basin and rinse with 0.9% sodium chloride solution, using the non-dominant hand to pour 0.9% sodium chloride solution. Replace the inner cannula and secure the locking mechanism. Reapply the oxygen source as prescribed. Tracheostomy care with disposable inner cannula. Remove the cap on the 0.9% sodium chloride solution bottle and pour 0.9% sodium chloride solution into a sterile basin. Open the package containing the new disposable inner cannula. Remove the soiled dressing from around the stoma and discard it in an appropriate receptacle. Assess the skin surrounding the tracheostomy for evidence of irritation or infection. Remove the T-piece or tracheostomy collar from the inner cannula of the tracheostomy tube. While touching only the outer aspect of the tube, unlock and remove the inner cannula of the tracheostomy tube. Dispose of the contaminated cannula in an appropriate receptacle. Position the oxygen source over the outer cannula. Remove gloves, perform hand hygiene, and don fresh gloves. Remove the new cannula from the packaging. Insert the new cannula and lock it into position. Reapply the oxygen source as prescribed. Clean the exposed outer cannula surfaces and stoma under the flange. Moisten the cotton-tipped applicators and gauze with 0.9% sodium chloride solution. Clean the area extending in all directions from the stoma. Clean with a circular motion from the stoma outward. Use the dominant hand to handle sterile supplies. Dry the skin and exposed outer cannula surfaces by patting lightly with a dry gauze pad. Insert a fresh tracheostomy dressing under the tracheostomy tube flange. Position the patient comfortably and assess respiratory status. Changing tracheostomy ties or tube holder. Instruct the assistant to don gloves and securely hold the tracheostomy tube in place. To change tracheostomy ties. With the assistant holding the tracheostomy tube, cut the old ties. Take the prepared tie and insert one end through a flange eyelet and pull the ends even. Slide both ends of the tie behind the head and around the neck to the other eyelet and insert one tie through the second eyelet. Pull snugly to secure the tracheostomy tube. Tie the ends securely in a double square knot, allowing space for only one loose or two snug finger widths. To change a tracheostomy tube holder, align the strap under the patient's neck. Be sure that the hook and loop fastener attachments are on either side of the tracheostomy tube. Place the narrow end of the ties under and through the flange eyelets. Pull the ends even and secure with hook and loop fastener closures. Verify that there is space for only one loose or two snug finger widths under the neck strap. Position the patient comfortably and assess respiratory status.